Why don't you give us her journey?
Bottom line, Joanne, in her 60s, bypass surgery, 4-vessel bypass.
Maybe that's her.
Maybe.
News Talk 550.
Hi, this is Joanne.
Hi, Joanne. We just tried to give you a call. How are you?
I'm doing great.
Why don't you give us your history and your journey through being diagnosed with COVID-19 and where you're at today?
Well, it kind of started with chills and fever and a really bad headache, and went to bed that night praying that I would be okay in the morning. The next day I got the weirdest call from one of my bosses, and he wanted me to go to Odessa, and I'm like, no, I don't think that's going to happen. I don't feel good. And he insisted that I go take a COVID test, which I did. Scary. Very, very scary to go take that test. Leaving there after the test, it was like I had no answers, nothing. And I felt lost. And came home, did a lot more praying. That same wonderful boss called me the next day and said he had somebody in mind that could help me get through this. And he sent me an amazing doctor that put me on some treatment. And, you know, I never hesitated, and I'm usually somebody that hesitates to believe in miracles, but I never hesitated. And I got through all of this because of them. Within 3 days after starting the treatment, I was already feeling better.
Now, what treatment were you prescribed and were you taking?
I was given some antibiotics, and I don't know all the legal just medical names, but I was given some antibiotics to take. But he put me on a breathing treatment,
like
twice
asthma.
a day.
Yeah.
And it's not something I've ever done, and it was first kind of really scary, you know, getting that mist in but it's like unbelievable how fast I was able to get through this.
Right.
The treatments were just amazing. I think it wasn't just about the treatments, though. It was about the personal texts and the personal calls that I got walking me through each step. Having somebody that cared so much about how to get me through this was, I think, what really, really helped. I believe that both of these people in my life have been God sent. I believe that he answered my prayers by making sure I got the right treatments.
You know, Joanne, this is Dr. Bartlett.
He's actually sitting right here.
Can you hear me?
No, is he?
Good morning.
He is. He's sitting right here.
Amazing, amazing man that cares so much that he took the time to see how I was really doing, and I think that's what helped me get through everything. His guidance of what I should do next and what I should do next. Changing it here and there just a little bit and tweaking it. It was unbelievably amazing.
Okay, Joanne, Dr. Bartlett has a question for you.
Hey, Joanne, do you mind us talking for a second about some of your health issues?
You can't hear him.
No.
I'm not real sure why.
Good morning.
Good morning.
So, Joanne, you mind mentioning for a moment, you had some things that kind of complicated your health as far as conditions that make someone at increased risk of having trouble.
I have a heart condition. I have heart disease, and I'm an ex-smoker, so I was scared about that.
How many years did you smoke, Joanne?
I smoke, let's see, I'm in my 60s, and I smoked from the time I was 13.
Okay.
I quit about 3 years ago.
So maybe 50 years roughly of smoking.
Oh, yeah.
And then also 4-vessel bypass surgery.
Yes.
Thyroid disease.
Stents. I've had 2 heart attacks.
High blood pressure.
So, yeah, it was scary.
And so
Very,
this
very
should be a situation that would have a bad outcome with what we're being told.
Yes.
And so you weren't put in the hospital on a ventilator, although there's a place for that. That wasn't your
Yes.
situation. And you were sick for a couple days before you started getting treated even?
Yes. I got sick on a Saturday, and we started the treatment Monday night, and by Thursday afternoon, all but the horrible taste and
which is a side effect of the
much
antibiotic.
I'm sorry?
That's a side effect of the antibiotics. So.
Antibiotics, yeah.
But, you know, I remember you telling me even while you were getting a treatment, you were feeling better during the treatment, which you never hear with this particular kind of medicine in treatment.
I felt better every time I did a treatment. I slept well, which on Saturday, it was like I just couldn't sleep because I couldn't breathe, and I couldn't just relax.
Yeah, there was a point where you were short of breath, if I remember.
Yes, I was short of breath.
And that reversed pretty quick.
Yes.
And so
the fever went away quickly. It's like all of my symptoms went away with the exception of the taste and just being really tired. But that was, the more rest I got, the better I got very quickly.
Well, we are so happy that you did recover, and what a blessing that is. And thank you so much for sharing this story with us and our listeners this morning.
Absolutely. Absolutely.
You stay healthy out there, okay?
I will.
All right, sweetie. Have a great day.
Thank you. You too.
Bye-bye.
Bye-bye.
There you go. You know, you hear about folks that are exactly as Joanne is, with all these pre-existing conditions, and everybody is so scared, but she recuperated, and thank you for sharing that story with us.
Well, here's the thing that is concerning to me. There have been obstacles to testing and obstacles to treatment, and President Trump is removing those obstacles as he goes, as best he can. It seems like new roadblocks keep getting thrown in the way.
And you did this with breathing treatments, like I said, it's kind of similar to asthma, but you also did it with an antibiotic where they're throwing out all these words that may not be necessary. There's other treatments available.
Well, there's multiple treatments that are being suggested and tried, and that makes sense since this is a new problem. President Trump mentioned one treatment option, and that was immediately shot down by Fauci. Hydroxychloroquine, and then also azithromycin, an antibiotic, and so Fauci immediately shot that down.